If you have just discovered that you have breast cancer, there are specific treatment options to help you recover. In this video, you will get to know the team of doctors and nurses that is treating you. Let's look at the type of treatments available, the procedures involved, and how you can maintain your health after the treatment. Let's start by looking at the different types of breast cancer operations. First of all, we have the lumpectomy. This is an operation where the cancer lump is removed with a rim of normal breast tissue. There are also oncoplastic techniques that can retain the shape of the breast. The second type is mastectomy. You may have also heard about mastectomy, which is needed for larger lumps in the breast or if there are multiple lumps in the breast. In this procedure, the affected breast is removed. If you are worried about your body image, you can ask for reconstruction of the new breast using a silicone implant or using your own body tissues. Otherwise, you can also choose to wear a breast prosthesis inside your bra. Other than removing the lump or breast, the operations will also remove some lymph nodes in the armpit near the affected breast. This is done to accurately stage the cancer. If the cancer has gone into the lymph nodes, the cancer will be at least stage 2. In early stage breast cancer, a sentinel node biopsy can be done. This procedure simply means that about 2 to 6 lymph nodes are identified in the armpit with a blue dye and radioactive tracer medicine, which is safe. Another way is to remove 10 to 20 lymph nodes with a process called the axillary dissection or clearance. This procedure has a higher risk of causing swelling of the arm in the future. This swelling is called lymphedema. The sentinel node biopsy is actually a better option, but it is suitable only in early breast cancer. Your doctors will explain to you the type of operation that is most suitable for you. You may be given a choice, so do discuss this with your doctor and nurses to make the best decision. After the operation, your tissues will be tested in the laboratory. The results will be discussed by your breast surgeon and oncologist to decide upon whether you will need chemotherapy, radiotherapy, or any other further treatments. To help your body heal, you should eat a balanced diet that has all the food components. Fresh and healthy meals with proteins are really helpful. Do not take any herbs or supplements 2 weeks before the operation until you complete the entire treatment. Some of these can affect your clotting and clashes with the treatment that may affect your health. You will need to stay in the ward the day before the operation. However, if you have other medical problems, be prepared to be admitted earlier. Firstly, get your operation date and admission forms at the breast clinic. Bring all your medical reports and medications and remember to inform your doctor if you have diabetes, high blood pressure, and so on. Next, you will visit the anesthetic clinic on the 3rd floor, Menara Timur, for blood tests, chest x-ray, and ECG to check your heart. The nurse and the anesthetic doctor will examine you and talk to you about the anesthesia. If you have any questions, this will be a good time to ask. During admission, proceed to the admission counter on the 2nd floor of Menara Utama. Register there and pay a deposit of 500 ringgit. If you are a government employee, produce your guarantee letter. You will stay in the transit ward near the admission counter. Do wait patiently while your bed is being arranged in the ward. At the transit ward, your doctor will check your condition and explain about the operation. After that, you can sign the consent letter. In this hospital, we perform many studies on finding ways of improving treatments for breast cancer. You will get some information on how to participate in these studies. Remember to bring a front open blouse. You'll need to wear that when leaving the hospital after the operation. Use pants or sarong with elastic band. Please do not wear any jewelry during your stay in the hospital. The hospital stay generally lasts 2 to 6 days. However, if you would like to go home earlier, you can always tell your doctor. Please take note of some do's and don'ts. You should not eat 6 to 8 hours before the operation. And on the morning of the operation, take a shower and shave your armpit. Please remove jewelry, dentures, and contact lenses as well. Thanks to the general anesthetic, you will not be aware or feel any pain at all during the operation, so don't feel nervous. After the operation, the anesthetist will make sure there is no pain and your condition is okay. Then you will be sent back to the ward. After the operation, you may find a plaster on the operation wound and one or tiny tubes at your armpit and breast area. These tubes is to drain out extra fluid from the wound. It is normal for you to feel numb at the operated area. The skin may feel a little bit tight. The shoulder and arm may also be stiff. Do not eat or drink until you are fully awake, which is usually about 4 to 6 hours after the operation. Sometimes you may have nausea or even vomit. Your doctors or nurses will provide you with some medicines for this. When it is okay for you to drink, start with some clear fluids. You can slowly increase the amount according to your tolerance. Usually, you can have a light dinner in the night after the operation. Don't panic if you have any pain or unusual discomfort or if you are vomiting or in need of the toilet. Just call our helpful nurses and they will assist you. You will also receive painkillers to help with the healing. Usually the painkillers are given in the form of injection on the day of the operation, and for the next 7 to 10 days you may take painkillers in the tablet form. The next day after the operation, you will learn some arm exercises from the physiotherapist. Be sure to keep doing these exercises so that your shoulder will not be stiff in the long run. And don't worry, your stitches will not open up. You will also get information and support from our breast care nurses and volunteers who have survived breast cancer. 2 days after the operation, the plaster on your wound will be removed, and a small plaster will be kept there to keep the wound covered and dry. And on the 7th day of the operation, you can remove the plaster by yourself. You can have a shower as long as you keep your wound dry. Around 3 to 7 days after the operation, the drainage tubes will be removed once there is less fluid. And after the tubes are gone, it's time to go home. Our breast care nurse will teach you how to care for the drains if you want to go home with it. Our nurses will remove the drainage tubes at the Breast Cancer Resource Centre on the 6th floor of Menara Utama. Sometimes fluid called seroma can collect in the wound. You may feel uncomfortable swelling and tightness. If this happens, or if you have any problems with the wound, do visit the Breast Cancer Resource Centre. The breast care nurse can drain the fluid away, and the relief will come quickly once there is less fluid and swelling. The fluid that collects under the wound is due to inflammation. Please don't worry because this condition is easily treated and will be gone after the wound has healed. You will not be able to see the stitches as they will dissolve by themselves and do not need to be taken off. Do continue with the arm exercises at home. You should also take your medicine according to the prescription. You will be given an appointment 1 week later at the Breast Cancer Resource Centre. Then your appointment with the surgeon and oncologist will be about 2 or 3 weeks after the operation in the oncology clinic. You will also be given a date to see the breast surgeon 6 months after the operation at the breast clinic. Check your blue card and yellow slip. They will look like this. Make sure that the dates are written down and don't forget to go to the appointments. Okay, if you are wondering about mastectomy bras and breast prosthesis, our breast care nurse will provide this information and they are always there to help. Remember the lymph nodes that were removed during the operation? This disturbs the drainage function of the lymphatic vessels. This can also happen after radiotherapy. Therefore, you may experience some swelling of the arm, also known as lymphedema. It can happen anytime from months to years after the operation. Not to worry, though it usually does not happen, it may happen in 1 in every 8 women. You will need to know that for patients who do not have any form of treatment, lymphedema will happen because the cancer spreads to the lymph nodes and blocks the drainage too. So after having treatment, continue to do the arm exercises and arm care to keep lymphedema at bay. To care for your arm and shoulder, you should, number 1, walk as soon as possible after the operation. Number 2, do some arm and shoulder exercises to get your movement and strength back. Number 3, you can do housework about 8 to 10 days after the operation. You can start with light ones like folding the clothes or wiping the shelves and move on gradually to heavier ones like vacuuming or mopping the floor. Number 4, stay away from injections, blood pressure checks, very hot or cold water, cuts, burns or any prick on the finger and the arm, especially when you're in the kitchen or when you're doing gardening. Number 5, wear loose and comfortable clothing. Tight bra straps are a no-no. Number 6, avoid tight jewelry on the shoulder, arm, wrist or fingers. Number 7, stay away from heavy lifting unless you have guided training in steady heavy lifting. Seek doctor's help as soon as there is any swelling, redness or pain in the arm. You may need urgent antibiotics. Complementary treatment is doing things that make you feel good, but it may not make any difference on the breast cancer. You may have also heard of alternative treatment, which is using other ways to treat breast cancer instead of medical treatment advised by your hospital doctor. Those selling or dealing with alternative treatment may tell you how their methods have cured cancer patients. If that sounds tempting, remember this: they may not have told you how many women did not survive after using their treatment. You see, till today, we have no scientific evidence that shows alternative medicine can cure cancer. On the other hand, medical treatments in the hospitals are scientifically proven. Your doctor can also help you weigh the advantages and disadvantages of each treatment before making a decision.
After the operation wound has healed, you may need more treatment. So this is when the oncologist comes in. You may have heard of chemotherapy. This is how cancer medicines are injected into the body through the vein so that any possible remaining cancer cells in the breast or in other parts of your body can be killed off. Now let's look at how chemotherapy is done. At the chemotherapy daycare unit of the Department of Clinical Oncology on the first floor of Menara Timur, chemotherapy is given once every 3 weeks for 6 times or 6 cycles within 4 to 5 months. Each process can take from 45 minutes to 3 hours depending on the type of chemotherapy. The oncologist may recommend that chemotherapy pot or chemopot be planted under the skin on your upper chest area. This makes the chemotherapy delivery process easier, you see, and is useful especially when the arm veins are difficult to find or to get through. The chemopot is inserted via a small operation under local anesthesia at the daycare operation center. After the chemotherapy is completed, the chemopot will be flushed every 3 months so that we can maintain its condition. When it is not needed anymore, the chemopot can be removed. You may be worried, is my body strong enough to endure chemotherapy? Now, before each of the chemotherapy cycle, the oncologist will check on you and blood tests will be done to make sure you are fit for the treatment. Now, it will be good to brace yourself for some common chemotherapy side effects. Now, these side effects are caused by our fast-growing normal cells being destroyed during chemotherapy, as the drug cannot differentiate them from cancer cells. Now, every woman reacts differently to chemotherapy, but the common side effects may include mouth ulcers, soreness in the vagina, nausea and even vomiting for some patients, hair loss, mood swings, feeling tired, reduced appetite, changes in the periods or menses, changes in the color and texture of the nail and skin, tickling sensation or numbness in the skin, and also weakness and fever due to the drop in the blood count. Now, these side effects may happen for a few days after the chemotherapy, and your doctor will prescribe some medicines to manage these side effects. The good news is that these side effects are only temporary. So recovery from these effects will occur after your chemotherapy is completed. Now, if you are taking any other medicines, vitamins, supplements or herbs, please remember to let your doctor know. Now, some of these medicines may interfere with your treatment or prolong or even increase the chemotherapy side effects. Did you know that 1 out of 4 breast cancer patients have HER2 positive type of breast cancer? If you are one of them, your oncologist may prescribe a targeted drug called trastuzumab, or commonly called Herceptin. With this drug, further cancer growth is stopped, and this improves your chance of surviving the cancer. For 1 year, once every 3 weeks, trastuzumab is given through your chemoport or your vein. It may be given together with your chemo or after your chemotherapy cycles. The good thing is that trastuzumab has fewer side effects compared to chemotherapy. In fact, most patients usually tolerate it well. During chemotherapy, you are advised to take someone with you to offer support during the treatment. Eat a light meal before the treatment. Have small snacks at short intervals. And cut down on raw, stale, spicy or deep fried food for easy digestion. Drink plenty of fluids. Suck on ice cubes if the nausea makes it difficult for you to drink water. Keep your skin, mouth and private part clean. Avoid crowded places and stay away from anyone having an infection such as cough, cold, fever and so on. About 3 to 4 weeks after the last chemotherapy cycle, you will be given radiotherapy. Radiotherapy is a high-energy X-ray given to the residual breast, the chest wall, and/or the armpit to kill any remaining cancer cells. A common question is whether the radiation will harm you. The dose and area of treatment are carefully calculated for your condition, therefore the treatment is safe. The process begins with a radiotherapy planning session. The oncologist and therapy radiographer will explain to you the procedure and mark the area to receive the radiation. Radiotherapy will only take a few minutes a day. You will lie still on the couch while the radiographer assists you throughout the session, and the oncologist will check you every week until the treatment is completed. You will receive the radiotherapy 5 days a week for about a month at the radiotherapy unit at first floor of Minority Mall. The good news is, unlike chemotherapy, the side effects of radiotherapy are mild. You may or may not experience them, which includes skin getting darker, itchy, sore or reddened, dryness of the skin, peeling of the skin, loss of hair on the skin of armpit and breast, loss of appetite, and tiredness. Now, there are a few tips to keep in mind while having radiotherapy, such as have someone accompany you during the planning and the first radiotherapy session. Bring warm clothing because the waiting area can get chilly. Wear a front open loose cotton blouse so the undressing is easy during treatment. A bra may cause discomfort after some days of radiotherapy. If you wish to cover the mastectomy area, a scarf or shawl around your neck may be more suitable. Avoid soap, deodorant, metal-based powder or cream on the treatment area. Avoid scrubbing, scratching or rubbing the skin in the marked area. Drink plenty of water. Exercise daily. And ask your oncologist if you have any problem during the radiotherapy. Some breast cancer patients have cancer cells that are sensitive to estrogen, also called the female hormones. If you are one of them, you can take tablets that will block the effect of estrogen in promoting future growth of cancer. Your doctor will choose the most suitable medicine for you based on your menopausal status, your breast cancer stage, your coexisting medical problems, bone mineral density profile, and any potential side effects. You will take this medicine once every day for 5 to 10 years. These medicines have names like tamoxifen, anastrozole, exemestane, and letrozole. You may also need other medications for bone health during some of the treatments. Now, many women do not feel side effects from the hormone therapy. However, some patients may experience hot flushes, which are similar to menopausal symptoms, mood swings, reduced sexual desire, joint pain or stiffness, vaginal dryness, disrupted or altered menstruation, thinning of the hair, rashes, nausea, and weight gain. While on hormone therapy, do remember to take the medicine according to your doctor's advice. Get yourself checked regularly according to your doctor's advice. Discuss with your doctor if you experience side effects. He or she may be able to recommend other options.
You can eat anything you like during the treatment, unless there are restrictions advised by your dietitian or doctors. Even so, you should eat healthily. Important tips to remember are such as eating a balanced diet to keep a healthy body weight, eat at least 5 servings of fruits and vegetables of different colors daily. How big is one serving? Well, it is the size of a medium-sized apple. Avoid sweet soda drinks, avoid oily and fast food, cut down on red meat. You should not eat it more than 3 times a week, and each serving should be the size of a matchbox. No processed meats, no burnt and overcooked foods, drink 8 to 10 glasses of water daily, and no alcoholic drinks.
Breast cancer patients can do physical activity and exercises to burn more calories and keep fit. Just 30 minutes per day will do. You can actually do some household chores, for example, mopping, gardening, or cleaning the windows. Take the stairs instead of taking lifts or escalators. Walking for 10 minutes before and after each meal. Walking a few rounds first at the supermarket before picking the items. Walking and jog on the spot while watching TV. Cycling, swimming, park your car further away from shopping mall entrance so that you can get to walk more. Join the neighborhood groups doing Tai Chi, Qigong, line dancing, yoga, and so on. But if you don't know where to look for such groups, you can also join our Candy Girls for some fun and dancing. There are breast cancer survivors and they meet at University Malaya Medical Center every Saturday. Your breast cancers can help you, so don't be shy to ask. If you feel tired too often, try doing some relaxation exercises or meditation too.
When your treatment is over, go on, enjoy and make the most of your new normal life. But keep in mind your regular follow-ups. In the first year after completing treatment, you will see the doctor every 3 months. Following that, the appointment will be every 6 months for the next 5 years, and thereafter we will be seeing you every year. You will be followed up alternately in the breast and oncology clinic. You should also get a mammogram every year as advised by your doctor. Remember, you need to stay physically active, do regular exercises, and maintain a suitable body weight. Support from your loved ones and friends will help you readjust to your working and social life. If you notice any unusual changes in your breast, chest wall, or body, such as coughs that won't go away, new headaches, yellow eyes, back or hip pain, or unexpected loss of weight and appetite, please see your doctor. You can walk into the breast clinic on Wednesday at any time. You may also be worried that your sisters or daughters may get breast cancer. Discuss these concerns with your doctor. We are here to guide and assist you.